Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Hi, this is jcoe, host of Talking Head Pain, the podcast that confronts head pain head on. I'm here at Dr. Kaiser, and he's going to share some really interesting research that he has come across at the American Headache Society's annual meeting. You'll also hear from him about some of the work that he's doing to help address the health disparities in headache and migraine care that are related to the LGBTQ community.
Hi, my name is Eric Kaiser. I am soon to be assistant professor at the University of Pennsylvania, where I am a headache specialist and researcher focused on studying photophobia and migraine.
It's such an interesting topic, Eric, and I'm really glad that I get to talk to you today to hear what you're hearing about the state of migraine research for patients at the American Headache Society's scientific meeting.
Well, thanks for having me. I'm excited to talk about some of the thrilling research that's going on here.
So can you give us some examples of things that you think patients should know?
Yeah, I think there's a lot of exciting research that's happening both kind of at the preclinical as well as the clinical stage of things. For instance, this morning there was a really exciting talk that was using some pretty exciting technology to look at how sleep may be sleep disturbance, particularly leading to increased aura, and using rodent models to be able to demonstrate that. And I think it could lead to really a better understanding of how sleep and headache might be interlinked between them. And then there was another great study that was done that looked at cannabinoids. So this includes how THC and CBD may be able to decrease light sensitivity using a rodent model, and I think we'll have real great applications for patients as well. There was another interesting clinical trial that looked at using artificial intelligence to be able to identify patients who may have atrial fibrillation, which could increase their risk of stroke, and found that people with migraine with aura have higher rates of atrial fibrillation that hasn't been detected, and that may be a factor that leads to increased risk of stroke for those individuals. And then this afternoon there was a really interesting kind of discussion about how we may need to adapt what outcomes we look at in clinical trials to really better represent the patient experience, and how they may respond to preventive and acute medications in the real world.
So it seems like there's been a lot of ground covered in the past couple of days at the American Headache Society. How do neurologists and other healthcare providers prioritize how they absorb this information? How do you approach a conference like this?
Yeah, I think being present and attending meetings is really where you're getting some of the cutting edge research, sometimes things that haven't even been published yet. And so it's really exciting to be in that space and then to be able to talk with those people in real life as well.
It's amazing and so important that people are here doing that work for us as patients. I was reading your bio, and I thought it was super interesting that you did some work and awareness around the LGBTQ community and migraine, headache, and neurology. Can you speak a little bit more about that work?
Been working with a number of collaborators from across the country to try and outline this kind of state of the scientific literature as it relates to individuals who identify as transgender and gender diverse, and think about how really the lack of research that's out there, and how this population is being underserved and both from a research and a clinical perspective. And so having kind of initial discussions of this is what the state of the literature is, this is how we can provide a more welcoming and affirming clinical environment to increase access for gender minority patients, And then what things should we be thinking about as it relates to potential effects of headache and gender-affirming hormone therapy, and where do we go from here? How can we increase research in this area? What we can do to improve our clinical practices for really this stigmatized population.
If you live in the US and you want to stay in touch with Talking Head Pain, text the word headache to 1-845-285-1563. That's headache to 1-845-285-1563. And you'll receive headache and migraine related resources, giveaways, and the latest Talking Head Pain episode releases.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.